Hello and welcome, Gold viewers from around the world. I'm Kristen Schwarz, licensed midwife and MC here at Gold. And I have a special guest with me. It's Megan Aucutt. Welcome, Megan. It's so good to have you here.
Thank you for having me.
Megan, you are part of our Labor and Delivery Symposium here of 2025, and your presentation is titled Bridging Community Connections Through Count the Gigs, Enhancing Prenatal Care with Digital Health. We're going to go into that in just a moment. First of all, tell me a little bit about yourself and your background.
Awesome. Well, thank you so much for having me. We're so excited to be on this Gold Labor and Delivery Symposium. Like you mentioned, I'm Megan Aucutt. I am the program director for Healthy Birthday, which is the nonprofit organization that created Count the Kicks, which is an evidence-based stillbirth prevention program. My background is in public health. I've been in public health for about 20 years, which is crazy to me to say, but my background here specifically with Count the Kicks, I've been with the organization for about 6 years. And my role here is really just how can we integrate Count the Kicks and fetal movement monitoring in a systemic way and a standard way. That's really my goal. Is I work with healthcare facilities and physicians and nurses, and I work with WIC and home visitors and community health consultants to really integrate Count the Kicks in a standard way, because kick counting's been around for a long time, but the standardization and the way we talk about it needs to be standard, and that's what I do.
Absolutely fantastic. I just wanted to ask you about this, right? Because this is nothing new. This is something we tell most of our clients. We tell them, have you felt your baby move? And then the typical, yeah, do your kick counts and such. But you're right. There's many different ways we've learned it, to talk to our
Mhm.
clients, or we have learned it in midwifery school, or wherever our education was done. And it is, there's so many ways. Some say drink some orange juice and do this, do that, and how many kicks per hour or 2 hours. And it feels, I have to tell you, it felt to me always very vague. It's like,
Mhm.
okay, just, oh, it's good enough if you feel your baby move, once,
Right.
that's okay. And now we know that research says quite differently, right? That there
Mhm.
is really a relationship between decreased fetal movement and adverse outcomes. And talk to me a little bit about that.
Yeah, so around 21,000 babies in the United States alone are stillborn. Around 2 million are stillborn across the world. Research indicates that about a quarter of those babies can be saved and that are preventable. And what that means is if we can identify risk factors, if we can identify ways to prevent those preventable stillbirths, we can save both potentially baby's life and mom's life. And we know, and research shows, a change in a baby's movement is sometimes the only warning sign that a baby is in distress. And so, what we've done is we've taken research and evidence and made it easier for you and less vague to talk about the importance of tracking fetal movement. So, 10 kicks in 2 hours is outdated. Research says we should move away from that. Drinking something cold to get baby to move, research says we should move away from that. It's all about getting to know what's normal for your baby. So you have the tools and resources as providers, as clinicians, to educate in a standard way how to count your baby's movements so your patients are clear. We always say clear is kind and communication is important. And so making sure that we're having this conversation should take 3 to 5 minutes to educate on the importance of tracking their baby's movements in a clear way. And that's what Count the Kicks does. It gives you those tools.
Tools are great. And I know in the digital age, many of our, yeah, you have a great app you want to show us here today too, because many of our parents, of course, they are now all on TikTok and everywhere, right? And they love their apps. So this is a great tool that you are going to show us now.
Yeah, so this is our Hallmark tool. This is our free kid counting app. So you can kind of see it there. I would just go search in the App Store for Count the Kicks and you'll see the little yellow clock icon. This is in over 20 languages and there's no ads. I think that's always a surprise to whoever like, well, it's free and there's no ads. I'm like, yes, it's free and there are no ads. It has been downloaded hundreds of thousands of times in 140 countries. And what it does is it helps parents get to know what's normal for their baby in terms of movement. So, what you can do is you just tap that teal footprint on the screen every time they feel baby move, roll, push. and a timer starts automatically. And so they tap until they get to 10 movements, and then the timer stops. And then the app asks them to rate the strength of those movements, because research says not only should we be paying attention to how long it takes our baby to get to 10 movements, but the strength of those movements. So they rate the strength, they can add notes, and then they get a graph, so a visual representation of the average amount of time it takes their baby to get to 10 movements. So it's, yeah, they're very, very easy, user friendly. There's a lot of other cool features like dark mode for us millennials out there that love dark mode and things like that. There's a contraction timer that's new, and that was because of app users and providers saying, I wish I had a free tool that I could share patients with a fetal kick counter and a contraction timer. So we just launched that too. So
Oh,
yeah.
absolutely fabulous. Great tools right there. And you mentioned something very important there. What is normal for their baby, right? Because every
Mhm.
baby is different. But one of the myths that we're obviously moving away from is like, oh, you're late in pregnancy, you're 37 weeks. Oh, baby's not moving that much anymore because space is so tight. No, we still have to, but especially then we need to monitor movement and such and kick counts. So I'm very grateful that you are with us here for this symposium here for Labor and Delivery Symposium for 2025, really talking about this important topic. Megan, before I let you go, any final wise words to our viewers here from your side?
I think I would say that you have such a powerful voice as providers, and people listen to you, your patients listen to you, and you have the ability to share the standardization of Count the Kicks and to truly make an impact. And I know you know firsthand how tragic a stillbirth is to the family, to your medical team, to the whole unit. And so if we save one baby, that's our goal. If we save one baby, and here we are, 15 years later, where we've had such a reduction in Iowa's stillbirth rate, we've had countless stories. I mean, that's what we want to hear, and that's why we're here. We're here to save lives, and we need you. And I'm so grateful for everybody listening today and for this opportunity to elevate this conversation. And so that was more than one takeaway, but I could say it just to standardize it, and we're just grateful. So thank you.
Oh, well, thank you so very much, Megan Aucutt, for sitting down here with me, chatting about the upcoming presentation, Bridging Community Connections Through Count the Kicks, Enhancing Prenatal Care with Digital Health Solutions. And this, of course, is part of the Gold Labor and Delivery Symposium. We get started in October, early October, but you can go to the website now to find out information about this wonderful presentation and all the other presentations in the symposium. You can go to goldlearning.com. And thank you, everyone, for watching. And thank you again, Megan, for being here with me today. Bye bye,
Thank-
everyone.
Bye.